Afternoon, folks. I think we're going to get started. We had planned on streaming this to the health department's Facebook page, but unfortunately we're not being given access, so that is not going to happen. However, we're pleased you could join us on short notice. This is, as you know, our briefing on the administration's response to the Inspector General's report released this morning regarding the city's relationship with Fully Fighting COVID Incorporated. This is for press only. If you're not a member of the press, we're going to have to ask you to log out. And we're going to start with opening remarks from our speakers, Mayor Kenny and Dr. Farley, and then open the floor to questions. And our press release spelling all of this out will be emailed to those of you on our distribution list shortly, and we'll include a link to the press release once it is posted in the chat. Please, though, ensure that your Zoom login includes your full name and media affiliation. I see some folks who are in the Zoom room right now where we don't see your full name or outlet. You can change that by mousing over the word "more" in the participants list and selecting rename. For now, though, let's go to our speakers. First, Mayor Kenny. Mayor, you have the floor.
Thanks, Mike. First, I want to thank Inspector General Alex DeSantis and his staff for their expeditious and thorough handling of this investigation. As you know, this report was requested by my administration in early February after concerns about Philly Fighting COVID came to light. I believe the findings of the Inspector General accurately reflect the mistakes that were made. I fully accept the recommendations of the report. More extensive training for staff on contracting, particularly in emergencies, and improved transparency about vaccination progress for the public. I know that Dr. Farley's response to the Inspector General report includes specifics on how both of these recommendations will be accomplished. I do want to address one key point of the IG's report. It found that Dr. Farley was, quote, disconnected and uninformed as his staff retained and worked with Philly Fighting COVID on providing vaccine. That is a shortcoming that Dr. Farley himself has previously acknowledged. On that point, I can tell you this. I wish he was perfect. I wish we all were perfect. But I also know that Tom Farley has devoted every waking hour of the past year in trying to manage the city's response to this pandemic as best he can. I believe his sage advice and guidance have saved hundreds, if not thousands, of lives. His being disconnected early on from the vaccination process was based on a decision that many managers make to delegate to others on their team. He did so because he was focused on testing, contact tracing, and ensuring we had the appropriate restrictions in place in light of changing case counts. I know he regrets that. I know that Tom Farley fully understands that the vaccination process is too important, too crucial to this stage of the pandemic to delegate. I know that he is now fully connected and informed. I've said before, there is no playbook to this pandemic. And without a playbook, mistakes are more easily made. Philly Fighting COVID was a mistake. We've said as much. But we must also note the Inspector General found no malice, no ill intent, no one seeking personal gain. This was a case of bad decisions being made in the midst of a lengthy and constantly evolving crisis, and a top manager who should have been more directly involved. I understand that. Dr. Farley understands that. So as we review this report, I urge all Philadelphians to keep the bigger picture in mind. The pace of vaccines being distributed to clinics is increasing rapidly, meaning more people can get vaccinated. During the 5 weeks of January, we received just under 200,000 doses. In the 4 weeks of February, we received more than 260,000. As we expect March to be much higher, as FEMA is giving us additional 6,000 additional doses per day at their mass vaccination site. And we just started getting the Johnson & Johnson vaccine. As of last week, there were 128 sites actively vaccinating people. And in the coming weeks, we expect to open several more mass vaccine clinics in every part of the city. What that means is that more than 285,000 people in Philadelphia have received first doses and are partially vaccinated, and nearly 122,000 have been fully vaccinated. And we are redoubling our efforts to improve the vexing issue of racial disparities in vaccinations. That disparity is a problem that absolutely needs to be solved as soon as possible. But it is important to note that the gap is already shrinking week by week. I remain extremely proud of Dr. Farley and his department staff for their tireless efforts over the past year. and I am confident that his plan and response to the IG's report will avoid any similar issues in the future. Our administration is